Greetings, friends. Today I would like to briefly discuss a uniting principle between ourselves as therapists who strive to provide the very best of care for our patients, or as one of our patients whose quest it is to restore your life to its fullest. You see, we share a common bond in that the recovery or restoration of movement health is far from a simple task. So whether as a therapist who not only has the passion, but also an in-depth knowledge and the necessary skills, or the patient who not only has the needs, but the motivation and the determination to reach your personally defined goals. We have for both of you a truly helping hand. So as you view this film, I would ask you to explore the following means by which the UE Ranger might personally assist you in either delivering your passion or achieving your recovery goals. Number one, the ability to support the full depth of need through a broad range of patient requirements. Number two, the ability to deliver both a graded progression of therapeutic influences while also simulating functionally meaningful recoveries. And finally, number three, the ability to demonstrate to insurance companies that yes, these applications truly can be justified as scientifically based, and as such, does require a skilled practitioner to fulfill such care. So I encourage you, therapist and patient alike, to capture your fullest potential by ordering yours today. So Audrey, this is the tool that we described in our last therapy session.
Okay,
And so what I'm going to do today is just introduce how we're going to use the tool to support the recovery of your shoulder motion, okay?
okay,
So we're going to use this portion to begin with, and we have two different options here. We'll use this one a little bit later on because it moves more, the joint,
oh, okay,
and this one we'll use first because it's more stable,
all right,
okay?
yes,
So we'll put that on the ground, we'll put this tool over the top of that, and then that holds that for you, okay?
okay.
So I'm going to bring this down, and we're going to put your right arm in here, okay?
Now,
Yeah, so if you want to scoot forward just a hair, now I'll do the work, I'm going to bring this to you, okay?
okay,
So we just slide your right arm in there,
okay,
okay, and just rest, okay?
all right,
So I'm
I'm
going to have
fine.
you sit just a hair taller.
Oh, yes, yes, always stand up straight for Dan Miller.
Yep. Okay, so that's going to allow the tool to support the weight of your arm, okay?
All right,
Okay?
all right,
So just rest there, and then now allow the tool to hold the weight of your arm, but I want to ask you just to reach forward. Not your upper body, just your arm.
there's my arm.
Yeah. Okay?
Oh, yeah, very good,
Okay? And then what you can do then is we'll eventually use some objects to grab, so your hand's free, okay? But you don't have to support the weight of your arm. So we can do more repetitions to help you get stronger,
okay,
okay? So as you're reaching out, you can just act like you're grabbing, and then come back. So just each time, act like you're grabbing, and then let go. Relax on the way back. So just reach out like you're going to grab something, okay? And then come back and just let go,
okay,
okay?
yeah,
Okay, Audrey, so we're going to resume where we left off, and you demonstrated good hand control, good strength with your ability to grasp, okay?
mm-hmm,
So now we're going to use an object that will allow you to utilize that grasp, and then we'll build up in your ability to both reach and sustain that grasp, like you're holding something to put it in a cupboard, okay?
oh, okay,
So I'm going to change out this hand support. So this, when you do this at home, you can interchange this, okay? So I'm going to bring that down a little bit lower. And then I'm going to turn it at an angle for you, okay? Just to accommodate kind of a natural position for you first. We'll go with this side, okay? So let me have you place your hand around there, just lightly, okay? And that way you're acting like you're holding something and
Okay.
sustaining that as you reach, okay? So I'm going to bring it up a little higher so as you're reaching, you're going up a little bit, okay?
All right.
So let me bring you up a little higher. Just keep your hand on there. And then I'm going to put this a little bit out in front of you, so we'll go off at a little bit of an angle. When you'll start low and then you'll elevate, okay?
Okay.
And just keep your shoulder relaxed. Allow the tool to still hold your arm. There you go. That looks good. Does that feel comfortable?
Oh, yes.
Okay, now I want to ask you just to kind of explore movement, like you're going to set the object over here and just go in different directions, like you could come out towards me. Good, just keep exploring. Now I'm going to let go and let you do that on your own. There, good job. And just kind of look at your targets. Look what just try to make it meaningful, like you're executing at home, all right? And we'll try this in standing here in a little bit, and then we'll work on your balance as you're reaching as well. Okay, Audrey, so we're going to resume where we left off, and you're doing so great, we're going to make it a little bit more challenging, actually more dynamic, okay?
All right.
So it'll be more realistic with what your current capacities are.
Okay.
So I'll ask you one more time, just bring your spine
Stand
a
up
little
straight.
bit more erect. That just helps your shoulder be in a better position, okay?
All right. All
So
right.
here's the change. So we're going to change this one out. And we're going to put this open hand here. But this will give you a little bit more challenge so that you can use your forearm a little bit too, okay? But I'm also going to take the base off. So this portion can come off as well. And this one has more mobility to it, okay?
Okay.
So that's going to ask more of your muscles, all right? So now I'll have you place your hand on top. This will go over the top of you.
Okay.
Okay, now this will just require a little bit more of your shoulders, so stay upright. Bring your spine up tall again. There you go, a little bit taller. There. There you go. Now that should feel more comfortable as you explore movement. So we'll start low just to begin with. And you're going to find that it's just, asking more of you, but you have more freedom because of that, okay?
Okay.
So that should feel really smooth now. The other one was a little bit more stable, but this gives you the opportunity to use your full strength. So let me bring it up a little higher for you, okay? So I give you a chance to do what you did before, where you can explore movement, okay?
Okay.
So you can act like you're going to go up here, and you could turn your forearm over, okay? Or you can go up here like that, okay? So just be creative, just explore, maybe like you're painting on that canvas, like you're reaching out to put paint on your canvas,
Okay.
okay? And that's good. Keep your eyes on the target. That way your whole body's invested in the motion. And just try a few with your thumb up. That changes the dynamics of your shoulder when you end with your thumb up, okay? There. You feel how that kind of opens you up?
Yeah.
You can breathe easier. Okay? All right, let's take a break. I'll bring you down. And then let's just do a cool down again. And just do a few low ones, just like you're sliding across the table, okay? Think of reaching for the objects when you're eating,
Oh.
okay? Okay, Audrey, so we're going to now pick up where we left off, but we're gonna now exercise while you're standing,
Okay.
okay? Because you've done so well, now we want to make it supportive when you're standing and able to reach to help you with greater function and your safety, your balance, okay?
Okay.
So I'm going to help you stand up, okay?
Okay.
And you can hold on with that left arm.
Okay.
Now I'm going to bring this underneath you again,
Okay.
okay? But we're going to do it in standing the entire time. So I'm going to get this up to just about where your elbow's at 90 degrees, okay?
Yep.
Maybe
Yep.
just a hair lower, just so. Okay, so just remember to let the tool hold the weight of your arm, okay?
All right.
Does that feel like a good place for you?
Yes, yes, very good.
Okay. All right. So now, let me ask you to bring your hand just a little bit more into it. There you go.
All right, all right.
Okay. So now, just act like you're reaching for your clothes in the dresser, okay? So just reach forward, make it meaningful, like you're just in your room and reaching for maybe items on your shelf or your dresser drawers, okay?
Okay.
How does that feel for your balance?
I'm just fine, absolutely fine.
Okay. Now let me ask you, let's do something just a little bit more challenging then. Okay, hang on to that, but let me ask you to take a step forward with your right foot. Okay, right there, good. Okay? Now what we can do is then reach forward, but then lean a little bit with your body. There you go, perfect. Okay? That just gives you a little bit more real estate, right? A little bit more options to get further from your usual. And then remember to reach out or to look out. Look out where you're reaching to.
Okay.
Okay? Go ahead and come back. And then can you reach over this direction?
Sure.
And then how about over this way?
You betcha.
Very good. Okay, nice work. Now just do a couple short ones again. Okay, stand tall. That'll just support your hip muscles and your breathing again. So everything's coming together. Okay, Audrey, are you ready?
Yes.
So what we're going to do today, we've done the standing last time. So today we're going to stand again, but we're going to use this device to help support the strength of your shoulder, okay?
All right.
So we can start reaching higher as you get stronger.
Okay.
So let me have you stand up and we'll walk over in this direction. I'll have you hold on here and then come around in front of this board over here.
Okay.
Okay? So
Yeah.
I'll put this in here for you. And what you're going to do is stand in front of that, okay? So I'm going to make that a little shorter for you. Okay?
All right.
So just face that straight on.
Okay.
Okay.
Okay. Yeah.
Now,
That's fine.
hold right there. And I'm going to turn this, well, let me have you step to your right. There you go. Good job. Okay, perfect. All right, Audrey, now just reach forward and just keep a little pressure towards that, okay? By you having pressure against you, it's making your shoulders work, your shoulder muscles work differently. So just have you stand a little taller. How's that feel?
Fine.
I'm going to bring it up a little higher for you, okay? Now, let me ask you to step back a step. Okay, one more step with your left foot. There. Now you can reach, and you could transfer your weight forward just a little bit when you reach. Oh, not bending over. Just put a little weight onto your front leg, your right leg.
Okay. Okay.
There. That's it.
All right. Oh, wonderful.
Okay. Now remember to reach, or look where you're reaching to. Good. Come back down. Nice work. You hit that target, didn't you?
Yep.
Okay. Go ahead and reach again and look up where you're going. Good. Come back. And then just reach a little bit of an angle out that way.
Okay.
Beautiful. One more over here and we'll take a break.
Oh,
Oh, very good. Let me bring you down. Nice work. That's your best. That's your personal best. Okay, so let's go just back and forth a couple little ones again. Just to end with. And then I'll bring you back on the ground. And then this will let you just relax, okay? Just go back and forth a couple easy ones. Recognizing our patient's current healing requirements are highly personal, yet one universal principle exists for each and every patient. In order to reach each individual's optimum potential, we must, within each and every treatment, meet our patients at their current impairment level and grade their progression within the demands that they can most favorably respond to. To say it more succinct, a therapeutic threshold or tolerance. Thus, in honoring this truth, the greatest value in applying this supportive tool will be achieved when normal movement production is left unimpeded, while simultaneously the individual's greatest physical capacities are enhanced.